And then we have a lesson on just the health of the respiratory system. So we're going to talk about um, 4 diseases that are common diseases of the respiratory system. We're going to talk about their description, their symptoms, their tests, their treatment, and their prevention. So we have laryngitis. Laryngitis is an inflammation of the larynx, right? We remember that the larynx is your voice box, and itis means inflammation. So it's an inflammation of your larynx that causes a raspy or a hoarse voice. This is the one that teachers often get a lot because we spend all of our day talking. Um, it results usually from a cold or a flu virus, right? So sometimes you'll hear viral laryngitis, right? That means that a virus has caused your laryngitis, but it can also be caused by by a bacterial infection. So virus and bacteria are two different things, but they can both cause infections in humans, and the infections can cause inflammation. Um, Allergies can cause laryngitis. So if there's something in the air that your body doesn't particularly like, it can cause an inflammatory response. So the inflammation, this is swelling that is caused by your immune system in response to an invader, right? Something that your body thinks shouldn't be there. So viruses and bacteria especially shouldn't be in your voice box, but also things like dust, and that can cause laryngitis because it's also a type of invader. Um, Cigarette smoke, not supposed to be in your voice box. It can cause inflammation. It's an invader. And voice strain. So if you use your voice all day like me, sometimes your voice gets raspy, and that's because your vocal cords are vibrating back and forth, and that can cause inflammation as well. Symptoms of laryngitis include a sore throat, fever, hoarseness of voice, right? That's when you talk like this, or complete loss of voice, which has happened to me. Once I was teaching kindergarten, and I had to sing like the wheels on the bus 5 times a day, and I lost my voice for about a month. It was pretty interesting. So when you have laryngitis and you go to doctor, um, the doctor is going to look at your throat, and he's gonna see if it looks red and swollen. That's inflammation. And then sometimes they might swab the back of your throat to see if your infection is viral or caused by a bacteria, right? They'll take a swab and they'll put the swab under the microscope and they'll see if they can see a bacteria. Um, and they will give you antibiotics if you have the bacteria. If it's viral, they won't give you the antibiotics because antibiotics don't do anything to viruses, only bacteria. And of course, if you have laryngitis, you might want to rest your voice and drink a lot of fluids to ease your inflammation, to ease your swelling. Prevention of laryngitis, uh, you know, um, good hygiene, meaning some people like gargle with salt water if they're prone to infection, mouthwash, that sort of thing. Resting your voice, not overusing it like I do, and of course, avoiding cigarette smoke. Pneumonia is also a type of inflammation, but it's an inflammation of the alveoli, okay, which decreases gas exchange and reduces oxygen levels in the blood, right? That's why it's dangerous, because we want, remember, homeostasis. We have to keep those oxygen levels at a certain level. Otherwise, your body can't make energy. Okay. Pneumonia is often caused by a bacterial or viral infection, and sometimes it's caused by like a number of bacterial or viral infections. So sometimes we get the the respiratory flu, and then our body is trying to fight off that flu, and then something else comes while we're fighting off the flu, and it's a secondary infection. So sometimes when you get pneumonia, you have been hit by two viruses, or a virus and a bacteria, or two bacteria at once, and your immune system just can't fight off both of them. Symptoms of pneumonia: fever, chills, cough, shortness of breath. That's a big one, and tiredness. So because your gas exchange is not working at its best, you will, when you're breathing, you're going to feel like it's not working, right? You try to catch your breath. That's what shortness of breath is. How do they diagnose pneumonia? You have a chest X-ray. They can see the inflammation in your lungs through the X-ray, and then they will probably collect and test your sputum. Sputum is medical for your spit, your saliva. Um, and they will try to find out what the bacteria or the virus is that's causing your infection, so they can treat it properly, because bacteria and viruses, they have different methods of treatment. Bacteria can have antibiotics, and some antibiotics work better on some bacteria, so they want to find out what it is. Viruses, you kind of just have to wait. There are antivirals as well, um, but most of the time, if you have a viral infection, they just tell you to go home and go to bed and rest and wait it out. So it says sputum is mucus coughed up from the lower respiratory tract. Right. So as you're coughing, there's like the thick stuff that you cough up, that's sputum. Antibiotics is a treatment for bacterial pneumonia. Antiviral medication is a treatment for viral pneumonia. And of course, we want to keep our whole respiratory system as moist as possible. So they tell you to drink fluids, right? And breathe warm air. Because remember, um, moist, warm air is good for gas exchange. And then, of course, if your pneumonia is bad, sometimes they'll have you hospitalized, just so that they can monitor your breathing and monitor how well you're doing homeostasis for oxygen in your blood. Um, since the bacteria and viruses that cause most cases are contagious, good hygiene is the best way to avoid pneumonia, meaning wash your hands, don't touch your face, stay away from anybody who looks like they have a level 5 virus, right? Wear masks if you know that somebody has the uh, some sort of flu and you can't avoid them. Cystic fibrosis, we've talked a little bit about. This is a genetic disease that affects the respiratory and digestive systems. Um, it's a buildup in the lungs of thick, sticky mucus that makes it hard to clear out harmful bacteria. Okay, so these people get respiratory infections quite a lot, and they have a harder time breathing because the mucus outside of their alveoli uh, creates a barrier for gas exchange. And it also prevents the pancreas from secreting digestive enzymes. Symptoms, you get a lot of pneumonia type infections, you have a chronic cough to try to move the sticky, thick mucus out of your lungs, and you're short of breath because gas exchange is not going well. Uh, so if you have cystic fibrosis, it can be diagnosed through genetic tests, right? So they'll take a sample of a baby's blood and they have a test that looks for the mutation in on the chromosome that cystic fibrosis um, is on. So you have a DNA test of blood or saliva of parents to see if they carry the gene for cystic fibrosis. A test of the sweat to see if it's saltier than normal. So if you have cystic fibrosis, because all of your secretions are thicker, your sweat is more salty. There's no cure for cystic fibrosis yet. People who have cystic fibrosis take antibiotics each day to control their viral infections, as well as drugs that open the airways and thin out mucus. And they can have other therapies like inhalation therapy to help their symptoms. Since cystic fibrosis is a genetic disorder, it cannot be prevented, right? You cannot change your genetics yet. However, people who have cystic fibrosis now live into their 40s and 50s as a result of newer understanding and treatment, right? So the earlier and the better the treatment, the longer people can live. And there are experimental therapies that are coming up that are gene therapies where they try to insert the correct gene for the protein that controls the salt coming into and out of your cells. Lung cancer. Lung cancer is a disease, well, we know cancer is, right? A disease in which abnormal cells from the lungs divide uncontrollably, creating tumors, right? And remember, these tumors, because they're always set to divide, they don't end up doing their job. So you have cells in your lungs taking energy from your body that aren't performing their function and are using all of your body's energy to divide. Um, so, lung cancer is the leading cause of adult cancer deaths in Canada. 80% of lung cancers are fatal within 5 years. And that is because they are likely to metastasize. So, remember how your alveoli are surrounded by capillaries, right? Each capillary, okay, um, it only takes a little piece of cancer to break off and go to the capillary and be delivered to another part of your body and set up a new tumor there, right? That's what metastasizing is. Um, Causes include but are not limited to tobacco and long-term exposure to smoke and air pollution. You can get lung cancer without smoking, um, but smoking increases your chances of getting lung cancer. Symptoms are shortness of breath, chest pain, loss of appetite, chronic bloody cough, fatigue, right? Because the cancer is taking energy from your body to make more cells, and you'll get a lot of chest infections. You can detect a tumor through a chest X-ray, CT scans, um, and sputum tests. Sometimes you can actually maybe uh, a bit of a tumor can become mixed with your mucus. You can have a biopsy, which is when they take a sample of your lungs and they test it to see if it's cancerous. Treatment, radiation, chemotherapy, and surgery to remove the tumors. Prevention, don't smoke, stop smoking, avoid secondhand smoke, and avoid air pollution, both indoor and outdoor. Respiratory diseases, a lot of these can be chronic, meaning they affect you all the time, or they can be acute, which affect people for a short time. So pneumonia is usually acute, but things like cystic fibrosis are stay forever. They're common. They're chronic. Um, and then here on the next page, we have some medical technology that is used to assess and treat. Do we have no, these are all for assessing respiratory health. So chest x-rays will um, you know, find tumors and other dense materials like inflammation, right? They're there for lung cancer, pneumonia, tuberculosis. MRIs use magnetic fields to show cross sections of bones and soft tissues. They're used to find blood clots for lung cancer and for cystic fibrosis. You have the sputum test. When they do a sputum test, they're trying to figure out what has infected your body. So they're looking for bacteria and microbes. Arterial blood gas tests, they monitor to make sure your respiratory system is working well, right? So they see how much dissolved oxygen and carbon dioxide are in the blood. And this can be used to detect asthma, which is the narrowing of the airways, and also cystic fibrosis. A stethoscope can be used to listen to the sounds of the lungs while a person breathes. And, if you have one of the respiratory conditions that results in wheezing, they can listen to your lungs and find out that your gas exchange is not going well. And then you have a pulmonary function test that is a lung function test. And that's used to measure the amount and rate of air that moves into and out of the lungs during breathing. So basically, I'll post a video of a pulmonary function test. You breathe into a tube, you take a big breath and you breathe into a tube for as long as you can, and they test how much air your lungs can hold. And this can be used to detect asthma, bronchitis, and emphysema. Finally, just a reminder that your respiratory system is just one organ system and it works together with other organ systems. The respiratory system is just one of the body systems that make respiration possible. Your respiratory system brings oxygen into your lungs. Your digestive system absorbs glucose, right? Oxygen and glucose go to your body cells, and then you um, through the circulatory system. So the oxygen from your respiratory system and the glucose from your digestive system are passed around your body through the circulatory system, and then they go to your cells, and your cells do cellular respiration, and then they get energy so they can function, right? So that I think I will also post a video for. And that is the entire respiratory system in one day, right? Um, Small system, but there is a lot to go over. So make sure you do your respiratory system homework, and then there is a quiz of the respiratory and the circulatory systems.